I've always loved music. I mean, I can't remember a time when there wasn't music around in life. My dad was a kind of amateur musician, played violin. I wanted to learn violin, and he told me not to learn violin because he could never work out where the notes were because it doesn't have frets like a guitar. So he made me learn the piano first, which I did, and then learned violin later. But there was always music around as a child. As a teenager, that was what I did. That's what I loved. I spent lots of time, practicing, but also making music with other people in various forms. And I think I went to university and I did music. I couldn't really imagine doing anything other than music. And in terms of music therapy, well, I think I found a second-hand book about music therapy in a bookshop in Arundel when I was on a summer holiday. And it was a book by Nordoff Robbins called Therapy and Music for Handicapped Children, which sounds really old-fashioned now, and it is. And it's got all these really old black and white pictures in it. But it describes the way they worked with classes in a school, special school, and it really kind of fired my interest. When I was training, I trained in this building. It's slightly different to how it is now, but we have rooms downstairs where people come for therapy. And we were able to take part in sessions and watch sessions, and we could see each week the person kind of warming to the music and taking control of it themselves and becoming more creative and directive of the therapist and stuff, and that was really quite impressive. And it's powerful with little children, but it's equally powerful when you see it with someone who looks very like you. So my second placement was in a community mental health centre, for example. So people very much like me, my age, similar circumstances in life, who found themselves having just been discharged from hospital, for example, and coming to music therapy in quite a socially isolated state. They found it very difficult to interact with people, but they could be expressive in individual music therapy, and in a group they could learn to be more collaborative and enjoy each other's company and take pleasure in things. I think being a music therapist is a real privilege for a musician because it's an extraordinary thing to be able to just spend a time with someone and really listen to them and respond to them and be creative with them. It is an extraordinary thing, so I don't intend to give it up. I'm going to carry on doing it. I hope I'll get better at it. I hope I'll kind of hear better and respond better, but that's a life's work. It never, just like any kind of musicianship really, you keep working at it, you keep learning new music, imagining new possibilities. So yeah, I'm here for a while.